Hello, everyone. Heather Holmes here with KTVU FOX 2 News in the San Francisco Bay Area. And joining me this afternoon is Dr. Chotani. We're going to be talking about COVID-19 and also his research into the disease and also his conversations with congressional lawmakers. So thank you, Doctor, so much for being here. I want to first talk with you about your initial thoughts when you heard about COVID-19.
So first of all, thank you very much for having me. And to all the nation, we will get through. We have to find solutions, and we will find the solutions and we'll make it through this thing. In 2003, when SARS appeared, one of the commitments that I made to the medical community, and a paper was published in Lancet, that anytime a disease like that happens, or any disaster that happens, I'm going to put together a lecture that could be translated in multiple languages for anybody around the world to download and use it as their own, so we can understand what the reality is and what are the myths about a disease. So that process started in 2003, then MERS came, then other earthquakes came, then tsunami came, then the pandemic influenza pandemic came, and it just went on, and millions of people were getting benefit from that lecture. And then, of course, now we were in this particular era time where we had a particular problem with SARS coronavirus 2. That's what it was called initially. So I said, well, there were lots of myths, and people were going in China and various other countries that you could use ultraviolet light on your body, or you could put some oils on your body. So I said, we're going to put together a lecture. So I put together that lecture, and that went out very early. I believe in mid to late January, that was out there and could be translated into multiple languages. And then every few days, I would update the epidemiology on it in terms of the numbers of cases, in terms of numbers of deaths, what was happening, how it was spreading across the world in different countries. And I was, in that particular lecture, I was telling them, listen, we got to be careful. There are going to be certain hotspots. And I was very much afraid that this disease would come to the United States, because we're such a massive country in terms of numbers and how, geographically we are so big. And having had worked on infectious disease epidemiology for so many years, over 20 years, I realized one thing, that once a virus is out, it is out. There's no stopping the virus, and it'll spread. And that is how infectious diseases or contagious diseases spread. So initially, everybody was going, well, you're not going to have it in the United States. Understood. But now we have come to the reality. And so all of that aside, what I'm really, really interested now is to coming up with solutions as a citizen. And I believe that we all have to work together. We've got to help the government. We've got to help our fellow citizens, human beings in our nation, to be able to do something for them, so that we can decrease the burden of whatever is going on. My objective over here is to find a way. There are two objectives. One is to find a way to get our nation back to work. I believe that there is a way and a path that we can get people back to work. And the other one is that we've got to find, vaccines are going to take a long time to develop. Therapeutics or drugs are going to take a long time. But we're not really sure what's happening over there, because there's so many clinical trials that are going on. And I was a chief scientist for the U.S. Chemical Biological Defense Program. So my job was to develop, as a chief scientist, my job was to oversee all the vaccine, drugs, and diagnostic devices for our warfighters. And that was my passion, and still is my passion, but I'm doing a little bit of a different thing now. And, what we've got, so I understand how long it takes. And, when people say that, oh my God, we've got a vaccine and first person is now being tested, that doesn't mean we have a vaccine. It takes about 18 months to get there. So what is the other alternative right now? So we have an old way of taking care of things. And small studies have demonstrated that this has worked in coronavirus also. Theoretically, it should work, and that is, plasma transfusion. So for that, what we need to find are individuals who have converted now, who are immune to the disease, so they have antibodies in their body, and they're not sick anymore. And we can take the blood, take the plasma out, use that plasma for transfusion, for people who are in intensive care units.
We are seeing that take place now. So is that where you hold the most promise right now for kind of getting us out of this pandemic?
So there are so many things that are going on, right? So one of the things that we have to understand and appreciate is that we've got to use every tool in the toolbox right now. Mm-hmm. So vaccine is a tool, drugs are a tool, antivirals are a tool, and then plasmapheresis is a tool. So let's see if we can find individuals. And, we've been very fortunate that, when people were saying that, these antibody tests were not good, we started doing them. Mm-hmm. And we've been doing them for the past 2 weeks now. And, we've screened. This is not a diagnostic tool. Let's be very clear. It's not a diagnostic tool. It is a tool in the toolbox. But what we can do is we can screen people and say that, whether they're infectious, so they should be quarantined, and if they convert and they become immune, at some point we'll be able to do that by repeated testing, and then we can identify. So we've got a couple potential candidates right now who had the disease, a full-blown disease. They are now slowly converting, and we've actually informed the American Red Cross, and I'm in contact with them on a regular basis to see if we can, these potential subjects, once they are completely converted, can be, or further testing can be used. Now, there are multiple trials that are going on, multiple studies that are going on across the nation at Hopkins and various other institutions. And I think this is another tool in the toolbox that we've got to use, because right now, the people who are critically ill in intensive care units, right? And there's no way that they're going to be saved because we don't have anything. Everything has failed on them. We can give, if we can give them, if we believe that this is going to work, and the experts are going to talk about it more and more, I believe. But the experts have already said that this is a potential treatment for patients that are critically ill, because unfortunately they're just going to die without anything, right? Mm-hmm. So if there is a chance that this thing can work, then we can save lives, and that's what we're looking for, and I'm looking for in particular.
So when you mentioned, though, about this desire to get everyone back to work and things sort of back to normal, do you have any time frame? I mean, what are you thinking as far as a timetable for things returning to somewhat of a level of normalcy?
So what I believe is that if you start screening in a massive way, and I don't believe in the home test kit, because then we really don't know what's going on, because there's no clinical judgment behind it. I think there has to be some kind of a clinical backbone to this entire equation. And if we can identify people who've never been exposed, think about it for a second. And there are some limitations to the antibody test. One of the limitations is that the first antibody that develops in the body, which is the IgM, develops 3 to 7 days after exposure. Mm-hmm. So if somebody was exposed yesterday, this test is not going to detect it. But if somebody was exposed 7 days ago, then we know that person was exposed. So that is pretty clear. Most of the people right now, have been exposed in one way or the other. So, there are weaknesses to this thing, but there's a strength also that if you were exposed 7 days ago, you will see IgM popping up. And if then you follow them for a little while, and then you see if the IgM goes down and IgG appears. Once the IgM is negative and IgG is positive, and that should take anywhere between 3 to 5 weeks, depending upon when the exposure was. After the exposure, one should be able to have developed antibodies in their body so that they can fight the disease. Now, there's another caveat over here, that we still are not confident in the data that has come out of China that reinfections don't take place. So if there are, if somebody gets a disease, gets healthy, we don't know if they are going to be, they can get the infection again. But at the same time, we can say with some confidence that now, you've got the antibodies, you're safe to go and work. Now, those people can become Captain Americas. Those are the frontline people, right? Mm-hmm. So you put them at the front, healthcare workers especially. Think about a healthcare worker that now has converted, has antibodies developed in their body, and now they don't have the disease. There's a very little chance that they'll get the disease again. And if they observe the precautions, right? If they observe the right things and right, I mean, the masking, the cleaning, the gowns, and all that kind of stuff, the chances of them getting reinfected because of the immunity that they've already developed, if they can still get infected, is very low. So they become Captain America for us. And that's what we want to do. But at the same time, how do we really identify people who have the disease? And those protocols are still being worked on. And I'm working with the American Red Cross, the chief medical officer. I have a meeting with her tomorrow, and we'll be talking a lot more about it. Those protocols are there, but we've got to solidify all that stuff. But at the same time, think about it for a second. In 1984, there was a blood shortage in the country. One state had the blood. They said, this is our blood, we're not going to give it to you. Mm-hmm. I do not want the same kind of scenario that hypothetically, if I have a couple of patients, right, and they turn seropositive, and I know that I can get serum from these people that can now help. I don't want to be profiteering from that. I don't want to control it. And that's why what I've done is I wrote a bill and sent it out with a white paper, a position paper that I wrote to congressmen, senator on both sides of the fence, and it is with the Speaker of the House also. Nancy Pelosi has gotten it too. So we can have a federal registry. The federal registry gives the federal government the authority then to make sure that every person is treated equally and every state is treated equally. We do not want people to kind of take control of that. I believe that I think for the sake of the nation, we have to have that, and that is what I would like to have.
And what was the response, or what has the response been like to
your? So the response has been that they've looked at it. Some of them have called me up. Their chiefs of staffs have called me. Mm-hmm. They've talked to me about it in detail. They are still looking into it. There are a couple of things that I've asked them to do, the ones who have called me. One is to make sure that, like PCR, the Commerce Committee in the House, which said that PCR is going to be covered by insurance. I want them to pass a bill that the antibody testing should be covered by insurance. It's not covered by insurance right now. So somebody's got to, this right now, it's like I got to think about, how many I can use, right? I mean, it does cost money. The operations do cost money. So if it's covered by insurance, then we can do massive screening, right? And it's screening again. It's very critical that we understand the difference between diagnosing and screening. So the antibody test detects antibodies. The PCR detects the viral load. And by the way, neither of them will ever be 100% sensitive or specific, because there's always a margin of error in everything. Mm-hmm. So that is number one. Number two is, what they've asked me is to provide them with more data in terms of how successful it's been. Right now, there's just one study that has come out that has clearly suggested that I believe it's 5 people or 6 people that they tested it on and gave it to, and they recovered. There are some weaknesses in the study, but still, I think it is a good study. And in the past, for other diseases, similar methodologies were used. And this is the oldest way of treating people, by the way. It's not nothing. This is not rocket science. Right now, what we can do is we can craft it in such a way that it is better, more robust science than it used to be before. That's all it is. The other thing that I was going to talk a little bit about is giving people the opportunity to go out and screen themselves mm-hmm. without any restrictions. So, for example, if you want to go get a test, right now you have to go to a doctor to get that test. What I would like to do is give the opportunity in a country that we live in for individuals, if they want to get a screening test done, to go to a spot and be able to do it. So the app that we have gives the freedom to individuals to be able to do that. They can self-assess themselves. They can go and get the testing done, and it's built in a way that the closest test site, if we have different test sites across the nation, will pop up based upon their zip code. It is HIPAA compliant, so privacy has been taken care of. It is on Apple Store right now, which is a medical app. So it passed the test, and we've been able to do it. This is exactly what the president had talked about. in all honesty. When the president said that, we'll have an app that is going to tell you, give you an idea if you are at risk or low risk, high risk, or medium risk, and it'll tell you where to go and get tested, it has that built into the system. So that's something important if people want to use it to be able to get that.
And what is that app, sir?
It's on our website. It is on carelife.md. But if you go, and if anybody has any questions, they can go to Dr. Chotani, drchotani.com, and all the information that they need is available over there, including the information about the app, including other things that I've been doing with testing, and they can see what we've done. Everything is transparent, as they're supposed to be, and we just want people to get back to work, and the nation get back to, we are a nation that builds, and the critical problem right now is that we are not building, and what I believe is that we just need to get back to work and find a way, figure out a way, using the tremendous amount of brain power that we have in this nation, right? I mean, we've got the best technologists, we've got the best scientists, we've got the best of everything. We've just got to put all of that together so that our nation gets back and becomes the leader it is. And that's why I am an American. And that's what I think should be the right way to go.
Well, that is the shared hope by so many of us. Again, Doctor, really appreciate you taking the time. Thank you so much.